Hi again. The next item on the agenda is going to be a presentation to you of some research results, some survey research results that a survey was done in preparation for this meeting. Actually, the planning committee for the meeting was looking forward to having conversations at this meeting about, again, thinking about what should be some priorities on a research agenda for population health. And knowing that there would be fabulous people like yourselves coming to the meeting was very exciting. We also wanted to see if we could, in some way, and not in a high-level scientific way, this is not a population-based survey that we did, but we also wanted to see if we could quickly get some other information from those out in the field working in public health, and in particular, non-researchers, about what are your research priorities in different types of research. So if we can get some more information before this meeting from a wide variety of people who are doing work in the field about where additional knowledge, evidence, data, science, whatever, would help them do their work and in tackling health inequities and making progress in public health, that would be great to inform our conversations today. And so Dr. Phyllis Meadows is going to present the results of the survey that we conducted. Phyllis is a colleague of mine at the University of Michigan. She is the Associate Dean for Practice in the School of Public Health and a Professor of Health Management and Policy. And she also is a Senior Fellow at the Kresge Foundation. So thank you, Phyllis.
Well, thank you, Paula. So I realized two things. One is I missed the meeting when I was given the assignment to do this. Yeah, and secondly, that I'm standing between you and lunch. So I think I'm going to try to move through these and keep us on time. So Paula already shared with you the reason why we did this survey, and it was really just to get a feel for what was happening in the field, what people were thinking, and then to perhaps get some fuel to help us maybe fuel this discussion this afternoon. So in general, this was really, I called it quick and dirty. Paula called it short and sweet kind of survey. And we looked for a couple of things. One, we wanted to get some information about what the field saw as research needs. We wanted to get a sense from the field about what they considered to be their priorities. We wanted to see how this research that was happening in population health was being used. And then we wanted to also, as I've said, move us forward in our discussion. So very simply, methods. University of Michigan took the helm and coordinated it under the leadership of Dr. Paula Lance. So Paula was instrumental in moving much of what you're going to see today. We did the approvals. We did a snowball sample, so many of you answered this survey, and we thank you for that. But the planning group all were asked to list 10 people that they thought would respond to this survey, and we got about 203 recommendations of individuals, and we sent a link to them back in August. And we got a response rate of about 110 of those responded, so we got a response rate of about 54%. We asked very simple questions. It was quick, and it didn't require a lot of time. We wanted to know what types of organizations were responding, the roles of the respondents in the survey. We asked them questions about the importance of research, particularly to a series of activities that they might be doing in their organizations. And then we asked each of the respondents to identify, we had three specific research questions, and we asked each of the respondents to identify 3 priorities under each of those 3. And I'll walk you through those in a minute. So the 3 research areas were, of course, one, to help us understand the root causes of problem issues and its implications in community or population health. So what priorities did you have or folks in the field have around understanding root causes? What other priorities did you have around designing evaluations, programs and policies and other interventions? And then finally, what questions or concerns did you have around research that might help to improve the translation of and dissemination of the research that you were doing? So, interestingly, we received, so let me just remind you, under those 3 research questions I just shared, we asked each person to identify 3 priorities. So each individual had an opportunity to identify 9 different things that they thought were important. Well, we received over 450 unique ideas. So I asked Paula about this just yesterday. I said, 450, are you kidding? We just didn't do a synthesis of this or something. You know, what happened? And she said, yep, as you know, Paula, that we got 450 unique responses. And of course, I mean, I think you can interpret that in a lot of different ways, but mine was the quick and dirty way of saying we're all over the place with what we want to know and what we consider to be priorities in population health. And I think that's why this meeting is important. The way the respondents answered those questions were by presenting research questions and sometimes just presenting issues. So what you're going to see in a moment are some combination of both. We tried to retain the original responses, and in your packet, you have a summary of those responses based on some themes. And we didn't change them or alter them, just corrected them if there were any typos. And then we sorted them to the best of our ability under those 3 research questions. And some didn't fit neatly, but we just sort of did our best to move them under those areas. And then conducted a content analysis to try to emerge some themes under those areas. Just to show you who responded, primarily from academia, but we did get some responses from local, state, and federal government. The other category are sort of your trade associations or membership associations and some nonprofit organizations. Primarily received responses from executive leaders and those who are working primarily in roles of research and evaluation. So we asked the respondents how valuable or how important was this research, population health research in general, to their organizational activities. And I'm not going to read, because I know you can read these, but I just want to highlight a couple. That a large percentage of folks said that the research was really important for priority and agenda setting. A number thought that for their public education activities, for their external policy interests, if they were advocacy organizations, and then setting their own research agenda. So they were using research to help define the research that they were going to do. So under those 3 questions, many themes really emerged, and we tried to collapse them to the extent that we could. But what you'll see in those themes under the research priorities around root causes, folks are really interested in the social and socioeconomic determinants of health. They're also interested in social psychological factors that impact health. What are some of those contextual influences? I think we heard that today. People spoke specifically about racism, segregation, and immigration. They focused on specific populations, early childhood, family, and adolescence, and special topics like food and obesity, nutrition, lifestyle behaviors, and some questions around health system and health system reform and the extent to which these collaborations or multi-sector collaborations actually influence health. So some of the questions that we saw under the first question about root causes was questions like, does poverty impact children from different race and ethnic groups differently? The effects of housing on anything, does it really matter? Increased understanding of adverse child experiences and adult health. The questions about the evidence of multi-level determinants and the combination of determinants. And then how does stigma affect health? And then the role of community in advancing health. So you can see lots of variation around those issues. The second research question dealt with interventions and policy, and how do you best design and evaluate these interventions, policies, programs, and practices. Some of the themes that came out of this were interventions related to obesity, food, nutrition, again, and physical activity. What difference did certain interventions make for particular groups, like social demographic groups? Were interventions different for children and adolescents, for certain special populations because of race or culture? And then those community level interventions, what difference did they make? Were they cost effective? Were they useful in actually changing health in community settings? And then public health system reform, what's happening with those efforts? So the examples of the kinds of questions that came out of that second research area about intervention were really kind of divided into two kind of categories, and those are sort of the how-to questions. People wanted to know, how do you begin to shift the wealth distribution to eliminate poverty in this country? Big question. How do you reduce racism and other forms of social stigmatization? How do you establish the appropriate incentive structures to attract markets to food deserts, for example? And then how do you tailor? What are the strategies for tailoring different approaches for different cultural groups? And then also, folks wanted to know things about effectiveness. How effective is the impact of affordable housing on public health? What is the impact of health in all policies? What approaches have really resulted in something meaningful in communities and for people? What's the most cost-effective community change strategies? And what is the impact of high-deductible health plans on health inequities? These are just some examples, many, many more. And then finally, the third question, which is what we've just talked a lot about with the last presentation, is the issue of how do you use the research, disseminate it, get it out into the field, okay? So again, of course, obviously the priorities would be, how do you get this to policymakers and clinicians, those decision makers who are out there? How do we raise awareness and motivate action? Themes around getting people engaged and active with the data. How do we identify and communicate best practices? So when we learn something that's good and it's working, how do we actually get it out into the field, into practice? This was the where's the money question. Where's the funding for this? Are there avenues or strategies within the research to allow for dissemination and communication activities? What are the best research methods and approaches? So we're looking for methods for dissemination, methods for better communication, and then obviously what we just discussed, the academic challenges to research translation. I have a whole discussion on that, so we'll save that for later. And then there's a theme of evidence-based medicine. How do we get what works out to the field faster and quicker? So some examples, and I've kind of run through a few when I talked about the themes, but some specific ones, we just pulled out a few. What are the approaches to adoption and spread of evidence-based practices? What's most successful? Can we gather some research to help us understand how to best communicate, bring these workable items out into the field? I'd love to ask the question, why do we keep repeating the same thing over and over again and continuously manage those same results without doing something different? Model policies for school districts. So folks said, are there some policies that are out there in the field that are working? Can we bring those together? How do we bring those together and make sure that we're using the best that's out there in more places. Looking for funding for multi-sectoral collaborative studies. How does that work? How to incentivize universities, okay, you've heard this, to better encourage knowledge exchange between institutions. Are we repeating a lot of the same work? And then how to raise the profile of the gray literature. Those are those white papers, those profound publications that are happening out there in the field, sort of practice-based evidence. How do we get those out and disseminate those in a credible way? So in summary, again, this is very short and sweet. You have a lot of details in your packet. We know a lot more analysis needed to be done, but we just wanted to sort of throw out some ideas, throw out some of the themes that emerge, throw out some of your ideas around research priorities and questions. We think there is a lot of information in this short survey that we did, a lot of rich information about the priorities, and more analysis needs to be done in order to really get to the bottom of that. But I think this gives us a little peek of the variety. I left the conversation yesterday with a colleague saying, and a little bit this morning, I'm not sure I know what population health is anymore. I really am not sure I get it. But hopefully after today, hopefully this survey and some of these results and some of the questions that emerge will help you in your small group discussions today, and maybe you'll be able to help me get it again. All right, thank you. So I don't know if there were any questions, which I'm going to probably have to punt to some of my planning group members on this, or any comments about what you've heard thus far, and you've got about 3 minutes before lunchtime. Yes?
Is there going to be a follow-up? Are you going to analyze the data you collected, or is this just exclusively to the
That's up to Paula. So, Paula, what are you going to do with this?
I don't know. So I'm looking forward to hearing from you if this is useful and informative to conversations this afternoon. Actually, someone who filled out our survey happens to be the editor of a journal and said that the journal could potentially be very interested in publishing what we found in this survey. Again, it's not representative at all, but it's information for the field that I think is very important and very instructive. So I do hope we do something for, with this, at least get it into the gray literature, which is so important.
Yes.
So thanks.
I wanted to ask you, what's your thinking about it? Is this something that you think would be useful, and, what about it would be?
I'm a first-year graduate student.
Oh, then definitely, I've answered that question then. No, I'm just saying.
There's just a lot of things that haven't come into discussion yet, like immigration.
That did, actually that did. On the list of priorities.
On your list, yeah. What is community, and a little bit more about housing and how, I have 2 children, so I have to, for the last year, answer a question, how come we have homeless people, and why can't the government, why can't we buy homes for them? So, and that's where ideas come from. From 9 and 6-year-olds, they start basing their, thinking on what they see around them. So if they live in a community where there's a lot of homeless people, where they see no diversity, where they can't really kind of understand and reason other than ask mom and dad tries their best to explain to them, that those sort of things come into my mind.
Okay, thank you. Any other comments? Yes?
One other question. In terms of who was surveyed, you need to use the microphone.
Yeah, I was going to say that, sorry. And just state your name again.
Sure, Ryan Springer. Just wondering how many community groups or community
folks were represented in terms of who was surveyed, if at all. And if not, that can be a consideration for the future. I think it'd be nice to see what feedback you got from this and how that aligns from actual community needs in terms of what they see as their needs in the community.
Yeah. I would say, you know, part of the limitations, I'll start, Paula, with snowballing, is we tend to get our friends and our colleagues, which is probably a lot of what you saw here is why we had such a high representation from academia. There were some folks from the nonprofit sector, but I don't know, you know, I have a different interpretation of what's community nonprofit and nonprofit. I kind of break them up. So I don't know. Paula, you want to speak to that?
I can say, because I'm the person who knows who the survey went out to. And actually, so we have a little over a 50% response rate, and I was predicting a 50% response rate. I will say that the response rate was much higher among the researchers who got the survey. But we did in the snowball sampling, when we started with the planning committee and people on the roundtable, which includes people who work in community with a lot of community groups. And the idea was, please get this out to your colleagues on the front line who are doing this work. We want to be informed by them. So there is some representation of that in there. Response rates differed from, and I've done a lot of community-based participatory research. I'm not sure if I was, I'm not sure I would have responded to this kind of survey either. So obviously other methods need to be implemented to get community voice into the mix on this. It's incredibly important. So appreciate your question. Thank you.
Actually, I was pleasantly surprised because I was actually thinking when we sent this out, because I do come from the practice side. I too was local public health officer in Detroit. And I always talk about, we liked partnering with the university, but they never did anything that we thought was relevant for our work. And so I was just pleased to see the governmental sector stepping up and using the research when we needed it. So I can't say we didn't need the research, we needed it and wanted it, but there was a misalignment between what we needed and what the researcher was interested in.
Yeah, hi, Beth Mayer Davis, University of North Carolina. So there's another player that is maybe not as represented here as might be helpful, which would be the world of clinical medicine. And so I'm doing a lot of work at my institution thinking about how to bridge those worlds in terms of clinical and community connections in a meaningful way. So I would just encourage that as this moves forward, that would be another sort of huge player or set of players to bring into the conversation.
So I'd like to ask you a question. So when you heard some of the priorities, which really had a lot of different dimensions from psychosocial determinants, et cetera, activism, just the dissemination process itself, if those folks that you're working with had been added to the conversation, do you think the priorities would have shifted or looked different from some of those that I shared?
First of all, I have no idea. But, as I've talked with people, my feeling is that it's not so much that any of the priorities noted would disappear or would be diminished, but that there would be an addition, perhaps of ways of thinking and of approaches in which, again, benefits that could be experienced by people could be enhanced with the integration of, and again, this is transdisciplinary, of work between the clinical and the community. So I would hope for a positive synergy rather than really anything else.
Mm-hmm. Thank you. Paula, you were sitting on your seat. Did you want to say something about that?
I'm thinking, should I sort of bite my tongue or say something now? And in the interest of having difficult conversations, I guess I will just throw out a perspective that for those of us who were here yesterday, I think Ana Diaz-Rue articulated very nicely. But I think I'm very encouraged by movement within the healthcare system towards thinking about population health. You know, the CTSI is thinking about community. It's moving in a positive direction. We heard a talk yesterday from CMS about what they're trying to do to move the needle on population health and payment systems. This is all incredibly important, but I do worry about a medicalized view of a lot of things that we're talking about. And what I've been thinking about lately is sort of this issue. I think that, yeah, I'm glad the healthcare system's finally starting to get this and they want to walk the walk. But I feel like also they're trying to walk a mile in other shoes, and now they're a mile away and they've got shoes that belong a mile, you know, down the road. So we're not going to make progress unless, yes, there has to be collaboration, there has to be more discussion and thinking about interesting synergistic ways to worry about it. But again, medicalized frames and coming from the predominantly from the healthcare system, who has all the money, a lot of the money. I worry about too strong of a voice in the mix on that, because I think it takes us away from some of the issues that we really need to be working on. That might not sit well with a lot of you, but quite honestly, that's how I feel.
Can I just add a comment since I'm standing here? You know, I think a lot about health equity, and over the years, and I'm an epidemiologist by my training and a nutritionist by training, and chair of the nutrition department, which at my university actually administratively lives in both the School of Public Health and the School of Medicine, which is part of why I seem to be the person that's been tasked with bridging these worlds. But with regard to health equity, you know, a lot of the conditions for which people end up getting treated affect individuals who live in low-resourced communities the most. And so, you know, I do think that there are ways to engage between medicine and public health in a positive way. So I appreciate and understand your comments, but I really do think that partly because of the need to address inequities in health, we have to bring these these groups, these entities, these ways of thinking and doing together in order to make progress. So that's my view, and I'm trying to figure out how in the heck to do that, which is actually why I came today. So, you know, hopefully we'll be able to have some discussion about that.
Well, I'd love to share with you a project that I'm doing with physicians to get them to think more with a health equity frame, and some of the results of that. It's been very interesting.
Hi, I'm Ellen Beck-Jord from the UPMC Health Plan, and I just wanted to build on what you said. As a person who wakes up and thinks about population health every day in the context of an integrated delivery and financing system, one, I guess, additional item that I don't think I saw on the list, though there was so much there. That
But it's a lot more than what you saw. So,
even that, but that I think is instrumental to this notion of bridging the clinical context into community. And just sort of integrating population health into a clinical context is the broad idea of informatics. And two things within that very big idea that I think are especially important is the role of person-generated data and our ability to begin to capture that, not just through mobile devices, but, you know, as a very data-dense and potentially useful lens into how social determinants of health play out in individuals' lives every day. And then the informatics infrastructure that we would need to, you know, nobody wants more data, right? We want information that we can act on.
Right.
And so even though we're making strides in being able to collect that data, I think we have a long way to go in making it useful and having it be a piece of information that can thread together all the different contexts that are relevant to population health. And so I think that's a big research agenda priority as well.
well, I'm looking forward to participating and continuing the discussion about the priorities for research in population health. I think it's lunchtime. Bon appetit.